Onc Live Insights is a video editorial program produced by Onc Live.
So why is it important to control liver metastases in patients with metastatic colorectal cancer? Despite all the improvements in the screening, we still have a large number of patients who unfortunately die from metastatic colorectal cancer. In the United States in 2014, about 139,000 patients were diagnosed with colon cancer, and 50,000 of those have succumbed to this disease. We know that metastatic disease spreads predominantly to the liver. In patients who are diagnosed with colorectal cancer, about 25% will present with metastatic disease. And another 30% of patients with colorectal cancer who did not have metastatic disease at presentation will develop metastatic disease. About 60% of patients with metastatic colorectal cancer at least will have liver metastases. And if we follow the natural course of those patients, and despite our efforts in controlling the cancer with chemotherapy, unfortunately the cancer eventually grows, and the organ that is most affected with this growth is the liver. There has been several series indeed that have looked at patients with metastatic colorectal cancer who died from colon cancer and determined that the number one cause of death is metastatic disease to the liver and the liver failure attributed to liver metastases. So we believe that in the majority of patients with metastatic colorectal cancer, the limiting factor for overall survival is the control of liver metastases. And even in the presence of extrahepatic disease, liver metastases continue to be the predominant cause of death in the majority of patients with metastatic colorectal cancer. So the more modalities we have that are available to us to control liver metastases, I think the more we will improve the outcome of patients with colorectal cancer. So the question is, how do we determine who is the most fit patient to undergo liver resection for patients with metastatic colorectal cancer? When we have a patient with metastatic disease, the first thing we have to address, can we cure this patient? And since liver metastases is the predominant organ or the predominant presentation for a patient with metastatic disease, we often have to ask ourselves, is this patient a patient who would benefit from liver surgery? And there have been several prognostic scores that have been developed to look at patients who have metastatic disease to the liver, and specifically patients who have disease limited to the liver without extrahepatic disease, and to determine if those patients have a high likelihood of being cured with surgery. So these are prognostic scores, and there have been several scores that have been developed. One is the Fong score that has been developed at Memorial, and another one is the Nordlinger score. And these scores will tell us if a patient is likely to be alive or cancer-free at 5 years after surgery or not. The variables that have been shown to be very important in prognostication of a patient with liver metastases as far as benefit from surgery include the number of lesions in the liver, the size of the largest lesion in the liver, if the liver metastasis has occurred at the same time that a patient has been diagnosed with colon cancer, meaning what we call synchronous metastatic disease, diagnosis at the same time that the primary colon cancer has been diagnosed, and the nodal status of the tumor. Is there lymph node involvement around the primary or not? Another factor that has been often found to be prognostic is the level of the CEA, which is a colorectal cancer biomarker. So by using these 5 variables, one can determine if a patient is more likely to benefit from surgery or not. But in general, even in patients who have a high score, which makes it more likely that they will recur, it does not mean that that patient will not benefit from surgery. It just means that it's less likely that that patient will actually be cured with surgery. And those patients may still derive an overall survival advantage with surgery. So I think these are prognostication scores. They're not really a go or no-go factor regarding surgery or not.